22-year-old male presents with a slowly growing, painful palpable mass in the forearm. I am showing you axial T1, sagittal T1, and axial stir magnetic resonance images of the forearm. Please describe the findings.
The T1 magnetic resonance images demonstrate a heterogeneous, poorly demarcated mass within the forearm musculature, containing interspersed lobules of intermediate signal and prominent high signal fat. The stir image shows high signal intensity throughout the lobular vascular spaces, separated by thin, low signal septa.
What is your primary diagnosis?
The findings of a muscle-infiltrating mass composed of hyperintense T2 vascular channels and interdigitated adipose tissue on T1 are characteristic of an intramuscular hemangioma.
What is the classic radiographic finding that, when present on plain films, is highly specific for a vascular malformation or hemangioma?
The presence of phlebolyths, which are calcified thrombi within slow-flow venous lakes, is highly specific. On radiographs, they appear as round, calcified focal opacities, often showing a lucent center.
What are the three hallmark magnetic resonance imaging components that make hemangiomas highly characteristic and recognizable?
The three components are multiple hyperintense T2 blood-filled vascular spaces, interdigitated high-signal T1 adipose tissue between the vascular lobules, and linear signal voids representing high-flow feeding or draining vessels.
Why can the presence of abundant fatty tissue on T1 weighted images lead to diagnostic confusion with lipomatous tumors?
The fatty component is identical to normal fat and suppresses on fat saturation. However, liposarcomas contain thick septations or nodular-enhancing non-fatty tissue, whereas hemangiomas are distinguished by the characteristic fluid like T2 signal of their vascular lakes.
How does the clinical behavior and border of an intramuscular hemangioma differ from other benign soft tissue tumors?
Intramuscular hemangiomas have poorly defined, infiltrative borders that dissect between muscle fibers. While benign, they frequently cause local pain or muscle atrophy and have a high rate of local recurrence after surgical resection.
What is the role of catheter angiography and preoperative embolization in the management of large hemangiomas?
Angiography defines the vascular supply and flow characteristics of the lesion. Preoperative embolization is used to devascularize the mass, thereby reducing blood loss and improving surgical visualization during resection.
Finally, what are your clinical management recommendations?
Asymptomatic lesions can be observed. If the patient is symptomatic with pain or muscle limitation, treatment options include percutaneous sclerotherapy, transcatheter embolization, or surgical resection.